I'm Ashley Block. I'm a case manager here at GSHC Surrogacy Agency, and I'm here to talk about the gestational carrier process and timeline. So during your OB care, they start the PBO process, which is the legal documents to make sure that you are not the parent, but the intended parents are the parents. So they can make all those medical decisions and be able to take the baby home at delivery. Case managers, we will let the attorneys know, hey, she's about 12 weeks now. We want to start the process. They like to start the documentation around 15 to 20 weeks. What's going to happen is they're going to write up some documents stating that the intended parents are the legal intended parents and how they're the intended parents, and that you are just a gestational carrier for them, and that you are to be relieved of those parent duties. So once those documents are done, they have everyone review them, make sure that everything looks correct. They'll have you sign them. Then they submit them to the court. And now the court process can take 4 to 6 weeks for them to process it and to for the judge to sign it. Once those documents are signed, then we can now share them with the hospital. So PBO can stand for pre or post. So depending on the state, like California, you can get it done before delivery is done. So you can get this document done stating, hey, these are the parents. Their names are going to go on the birth certificate. They have every legal right to make medical decisions for the baby. Now, states like Idaho, which is a post, what's going to happen is they put a lot of stuff in place to make sure that when you go to deliver, and that your name is not going to be on the birth certificate or you're stuck or anything like that. They put everything in place to make sure that the hospital knows, hey, these are intended parents, even though we can't get the documents done after baby is born because they need to have birthday, like stuff like that for the baby, but they help make sure that everything is in place so that you are not stuck, that you can just deliver baby, hand them off to parents, and be able to go home once you're discharged. And they take over taking care of baby, making all those medical decisions and stuff, and they get to take them home. A power of attorney can be someone that the intended parents are going to trust to take care of their baby. So if something were to happen to them, somebody else will take baby so that the surrogate mother is not responsible for baby if something were to happen. Intended parents can use a family member in the States, or they can use our agency. We help step in to help be there for the intended parents. We will be the ones in charge of all medical decisions and taking care of the child. What we do as the agency is we bring the baby back to our baby center, where baby will have his or her own room with their own nanny, who will document everything. That's if the intended parents cannot make it in time for the birth or just not able to travel. Birth plan. So you will get an email with a birth plan document, so you can print that out or you can fill it out online. And it's just gonna kind of go over what you want to happen during your labor process. Don't worry about filling it out and thinking, oh, what do intended parents want? No, it's what you want during that delivery process. You're the one in labor. You're the one who's gonna have this baby. So it's up to you. There are some who don't want epidural. They're like, hey, I wanna do with no meds. That's totally fine. That's up to you. I have seen some that want to put on there like, hey, I want to do my own like birthing position. Some of them don't want to lay on their back, and that's totally fine. You can put whatever you want on there. We have tons of options on the birth form that we give. There's a section on there that you can list out things that you want as well. And we also have options on there if you would like to pump for baby while in the hospital. Some other things that could come up is cord blood. If intended parents would like to collect cord blood, we will have you sign an agreement with that. You'll get a kit in the mail, and this is something you'll bring to the hospital with you as well. It's a big thing with international intended parents. So cord blood, what happens is they're going to get a certain amount of vials of blood from the cord, and then they also take off some of the tissue and they save it. So what happens is stem cells. So they store it away, and if something were to ever happen to their child and who they're like, hey, we need stem cells for this, now they have cord blood put away. And that helps. We also have listed on there who you want in the delivery room with you. Don't feel pressured. If you don't feel comfortable with having intended parents in the room, that's okay. You're exposed. It's whatever you're comfortable with. So if you're like, hey, I only want one specific person, then that's totally fine. If you want intended parents, but you want them to be limited what they can see, that's okay too. You need to voice that or let your case manager know so we can voice it for you. There's also a line on there, if you have to have a C-section, who would you like to be in the room with you? We always say pick your partner because that's a vulnerable time. You're going through a surgical procedure. you want someone there who's going to be able to comfort you. Like after you have a baby, you're like, hey, I don't want to see baby, no communication. Please let us know so that we can make sure everyone's on board, on the same page. If it's something you're like, hey, I want to do skin to skin with baby, we need to communicate that with intended parents, make sure everyone's comfortable that they could do that. And if there's something on there, you're like, hey, it's not on there, but I want to do this, definitely list it. If you have questions about anything, please don't hesitate to reach out to your case manager about it. It's up to you. You're the one going through labor. It's what you want. You have to be comfortable during that process, but you will not be stuck with the baby if you do not want to. I personally don't recommend more than an hour of skin to skin or bonding with baby. Your emotions just are at an all-time high. It will lead you to bonding more with the baby than you expected. Your emotions get to you, and it's better to prevent like postpartum depression, baby blues, whatnot, because that still happens. Even though you don't have a baby with you, it can still happen. We also still continue to offer support. And if you're feeling like, hey, I'm feeling down, we're always gonna say, definitely reach out to your healthcare professional, so your OB. Reach out to your OB, let them know how you're feeling. If you're needing extra support, seeing a psychologist, let us know so we can provide that for you. You can still join the support groups. And if you're needing extra, please let us know. If you have insurance, a plan was purchased for you through your IPs. That insurance covers you for up to 3 months postpartum. So from the day of delivery month, you still have that insurance. So if anything happens, then you still have that backup. We'll also help you connect with accounting, do your final lump sum of your compensation, whatever else is needed to be reimbursed. We just want to make sure you're taken care of. So definitely reach out to your case manager to make sure that you have everything that you need. Don't hesitate. Don't feel like, oh, I already delivered a baby, I'm done. No, we are still here for you to help support you throughout that entire time.